Joining me is Dr. Amanda Kai, adult congenital heart disease cardiologist at Penn State Health. Welcome to you. What is congenital heart disease?
Thank you for having me here, Amy. So congenital heart disease is a structural malformation of the heart that usually forms before birth or in utero. This could be something as simple as a hole in the heart or a septal defect. It can also involve abnormal valves, different number of chambers of the heart, or abnormal connections between the chambers and the blood vessels. Usually severe or at least moderate congenital heart disease presents early in childhood, and the children who are born with these defects need intervention early on, surgery, etc., and they need lifelong surveillance. Milder forms of adult congenital heart disease actually don't present until later, and oftentimes can be diagnosed during times of growth or change in the body, such as adolescence or pregnancy.
Is it ever detected in utero, or do you not know?
Yes, it is actually. We do have screening programs such as a fetal echocardiogram or an ultrasound of the fetal heart that is done frequently. We recommend this test for mothers who have congenital heart disease themselves, or if the father of the baby has congenital heart disease, there is an increased risk to passing that on to the offspring. And so we do recommend a fetal echo in the second trimester, and that can detect that.
That's so interesting. And I know you are working closely also with maternal fetal health at Penn State Health. You can help women with this condition have healthy pregnancies. You can help them have healthy deliveries. Talk about that program.
Yes, so we have an excellent opportunity to partner with our maternal fetal medicine colleagues at Penn State Hershey to build what is a comprehensive cardio obstetrics program. So this is what we hope to be a one-stop shop for our patients who are pregnant with cardiac disease. They can see a cardiologist and an OB at the same time in one clinic visit. They can also get a lot of their testing done, lab work, EKGs, an echocardiogram, ultrasound of their heart for themselves, and a fetal echocardiogram. We also are planning to build an inpatient consultation service, which is great. It's already in action, so that we can provide this specialized oversight of complex congenital or acquired heart disease that might have an effect on labor and delivery.
You had mentioned screening in the second trimester if there's a family history there. But I understand you also can work with women even before they become pregnant and then monitor them through the program. How does that work?
That's right. So it's very important to know your risk. So pregnancy is a 9-month stress test for the body. It is really important for patients who have heart disease, either congenital or acquired, to understand their anatomy, their physiology, their risk, and also understand what testing needs to be done, what interventions or therapies might improve their chances of having a healthy pregnancy and delivery. So we talk to patients about that at their preconception counseling visits.
You yourself are seeing patients at Penn State Health in Lancaster. So talk about that location, what's offered there, what types of patients you're seeing there.
Sure, yes. So we have a brand new clinic site that we're doing outreach at. It's the Lancaster Pediatric Center, and a lot of people don't know that we actually see adult patients there. So we see general cardiology, we see adult congenital heart disease, we see cardio obstetrics. You can come and get your EKG done there. We have echocardiography availability, lab work, and we have multiple providers that go there. So it's a very useful resource to patients with cardiac needs in the Lancaster community.
It's interesting to me that you are an adult congenital heart disease cardiologist, but you're working so much with families and young, people too, and even babies before they're born. I don't think you're just an adult specialist.
Well, I think that this is a really special field. Adult congenital heart disease is something that has developed rapidly in the last couple of decades. So as of the turn of the 21st century, there are actually more adults now living with congenital heart disease than there are children. So that's about 2 million or more in the US. Unfortunately, not all of them are in care. So we are trying to get the word out that we have these services. We have multiple doctors and specialized providers here at Penn State Hershey that can provide both clinical as well as interventional services. And we also have dedicated imaging to diagnose congenital heart disease, sequelae of repairs, et cetera. So it is a really wonderful service, and we have a very close collaboration with the pediatric cardiology and pediatric congenital surgery teams at the Children's Hospital.